Hey guys, my name is Kevin. I'm one of the exercise specialists here at the West Primary Care Network, and today we're here to talk about back pain. This is going to be kind of class or video number 2. If you haven't seen our video number 1 yet, please start with that. I'm going to use some of the concepts explained in that video. Today we're going to talk about spine hygiene. So positions of relief. If your back pain gets really bad, how can you kind of settle it down a little bit? Because if your back pain is extreme, then there's not a whole lot we can do until it settles down. I'm going to talk about the difference between moving about your spine and moving about your hips. So I'm going to try and extrapolate that a little bit into bigger movements that you do throughout the day and how to change the way you move, basically. And then thirdly, we'll talk about different ways of picking things up off the ground, different ways of moving, kind of similar to what I just talked about there. And then finally, I'm going to tie what I teach you there into movements throughout the day. So when you do the laundry, you do the dishes, vacuuming, that kind of stuff, how to move in this different way that I'm going to talk about. So first of all, positions of relief. So if your back pain is really bad, if you're at that 7 or 8 out of 10 or just anything you do, it hurts, you need to find a place where you can go to let your pain settle down just mentally and physically, so it stops swelling, it stops kind of overreacting. So this is a very difficult concept to explain in the video or in a video to a general population, because Dr. McGill's concept on back pain is it depends. So for every person, their treatment, it depends. It depends if flexion of your spine is what hurts your back, or if extension of your spine is what hurts your back. The treatment is going to be different for every individual. So you kind of need to go along with me and self-identify which category you fit into, and then try the spine-sparing movements in between. Always, it's going to be better if you can see a clinician and they can help you pinpoint what the problem is. But at least right now, during COVID, our appointments are limited and we're not able to do stuff like that. So I'm going to kind of lump people into 2 different categories. One is going to be flexion intolerant, meaning you do not like bending of the lower spine. That causes your pain. And then there's other people who are extension intolerant. So those would be people where walking or their lower back, if it ever bends backwards, that's what hurts. So that's what causes their pain. There is some people that go into both categories as well, and I'll give you the fix for that too. So let's start with flexion intolerant. So if you do not like rounded lower back, or you do not like flexion, that causes your pain, then chances are sitting all day, if you have a sitting job where you're typing lots, this would be considered a flex spine. So a couple main ways to get out of it. First of all, I would invest in a good lumbar support cushion, so that at least when you're not actively thinking about your back, that lower back can have something pushing in so that it can keep your spine extended, out of flexion, and that will more or less reduce your back pain over the day. In terms of positions of relief, one position and Dr. McGill's kind of main position would be lying down. So if you're going to lie down into the ground, just make sure you do it in a way that doesn't hurt. Hands onto here, I would go in a reverse push-up fashion, trying to keep your back still. Going from here to here, I don't want you to go down like this. That would probably hurt. So either like that, or if you get down onto your side and lay down onto your side like that and then onto your belly, those would probably be better ways of doing it. So once we're here, hands underneath your chin, and take a nice big deep breath. And then I want you to imagine your lower back sinking into the floor or into the mat. And we're going to do this about 4 to 6 times, maybe let's say 20 seconds up to 3 minutes. And just take some time and let your back settle into the mat. That should really take away a lot of that pain that's caused from flexion, because our back is now an extension, okay? Another simpler, easier way of doing it is if you are sitting and you're sitting for a long period of time, typing away, a good way to kind of reset your spine is stand up, reach your hands over your head like this, and hold it up there for about 10 seconds, and then back and down and there. That should really reset your lower back as well. So those are good positions of relief for someone with flexion intolerance, so don't like bending. For people who don't like extending, so this would be people who walking hurts and any kind of extension of their back hurts, or if you've been diagnosed with spinal stenosis, chances are you're a person who really likes sitting and you could sit all day. So that is your position of relief. You can either go like that, or if you're on your back, just have both legs bent, and you could give your legs a little bit of a hug as well. But the whole point of being here is just to be in a safe place where you don't feel pain. So honestly, it doesn't matter to me too much what it is, as long as you have a place that you can go to take away some of your pain. So next I just want to get into really quickly some kind of tips on standing and things you should think about and different strategies that you can use while standing. So I'm going to talk about it a little bit about neutral spine. So you'd be extended or flexed in neutral spine. Neutral spine's in the middle. What I'm going to teach you guys is lean back, lean forward. You're going to feel a big difference in your back muscles and how hard they have to work. So if you want to, take your hand, put it on your lower back while you're standing. We're going to be feeling these muscles right here on either side of your spine. And you can just usually feel them with the back of your hand. And I want you to lean forward onto your toes and then lean onto your heels. And then onto your toes, onto your heels. You should feel those muscles turn on when you go forward because they're trying to hold your spine upright. And then if you lean back a little bit, you should feel them turn off. So if you're standing on your toes and leaning forward all day, then these muscles are just overworking all day. So a new way to think about it, it's really nice to have your hand there and feel the muscle turn on and off. If you lean back just a little bit, that's step one of how to stand better. Step two is about your shoulders. So lots of people are like this, and that'll encourage the hunched over posture and your shoulders like that. So take your thumbs, open them up, and point your thumbs out as much as you can, and that will open your shoulders right up. Now, standing like this is kind of a weird way to stand, but if you just think about keeping your shoulders there, you can drop your hands down into a more neutral place, or just put your hands behind your back, and that will kind of ensure that your shoulders are more open and back rather than hunched forward like that. So that's one and two, and lastly is your chin. So if you're like this all the time, it can be quite hard on your neck. So just think about tucking your chin in, ears over top of your shoulders, and then that's as good a standing as you're going to get. So that should, if you stand in the same place for really long periods of time, the only thing that's really going to help you is a little bit of sitting and go for a walk and move around. But what this will do is it'll buy you more time that you'll be able to stand without back pain. Okay, so that is the position of relief for flexion and extension intolerant. Now we're going to get into the third one. My most favorite is walking. So one of the best things you can do usually is just get up and walk around for, depends on the person, 10 seconds to 2 minutes to 5 minutes. Just go around and move. So Dr. McGill has a mandatory walking program in every one of his rehabilitation patients. So not only is walking good to interrupt sitting and interrupt like long periods of time where you're not changing position, like if you're sitting for a long time or you're standing for a long time, but walking is also just therapy for the back. It allows the back, the muscles, the way the muscles kind of work is they contract and relax, go back and forth. When this happens in your spine, and when it happens in any one of your muscles, it increases blood flow to the area, and it'll help more or less warm it up. I usually use the analogy of bread. If the muscles back there get warmed up, they're much more stretchy and bendy. than if they are cold and tight. Okay. So walking program, the best advice is really go for a walk 1 to 3 times a day. Dr. McGill advises 3 times a day. Walk as long as you can until your back starts to hurt a little bit or your back pain starts to increase. So if you can walk 5 minutes and then it starts to get worse, I want you to go for 3 4-minute walks per day. If you can walk 10 minutes and then your back pain starts to increase, I want you to go for 3 9-minute walks in a day. And over time, this amount of time that you walk until your pain increases should lengthen, okay? So that is positions of relief. We went over laying on the mat or reaching over your head for the flexion intolerant person, for extension intolerant, basically anything sitting or lying on your back and hugging your knees, or even just having your knees bent could be a position of relief for you. And then walking. Walking should help relieve both people. Okay. So next we're going to talk about hip movement versus spine movement. So this is getting into that spine hygiene. Once you understand this principle, then we can apply it to daily movements. So in the last video we talked about neutral spine. Neutral spine has an inward curve, just a little bit of an inward curve of your lower back and a little bit of a rounded curve of your upper back. So I'm going to stick to the lower back because I don't want this video to be 30 minutes. So you have this nice inward curve of your lower back. Spine movement looks like this. Now, most people can get away with spinal movement. Your back is made to move around. But if it's in an acute phase of injury, or if it's being chronically re-injured and never healing, then the more spine movement we do is like ripping off that scab. So what I typically recommend is and so does Dr. McGill, is at least 2 to 4 weeks, maybe up to 6 weeks, you need to move differently. We need to turn this into a rock until your back heals. Once your back heals, you can get into a little bit more of that spinal movement. But for now, I want to try and keep your lower back more or less as still as possible. Walking is okay, but I don't want to have spinal bending like that or too much extension like this. It's just, it's opening up too much possibility to be ripping off that scab over and over again. So the way we do it is find neutral spine. So first of all, you can do this if you want to. Don't go into pain, don't cause your own pain, but this would be spinal flexion. This is spinal extension. Find the middle. And everyone will have their own whatever feels best, but you should be able to find somewhere between here and here that doesn't hurt. So once you have that place that doesn't hurt, I'm going to call that your best neutral spine. And then from there, I want to do some core bracing. So I have another full video on core bracing, but basically take your fingers, poke them really deep into your belly, and now cough. You should feel your abdominal wall contract. I want that turned on. So another analogy is a boxer is going to punch you in the belly and you brace to stop that punch. That's what I want to have going on. So we find neutral spine, core brace, and now from here to here we're basically locked in. Okay. Now we're going to learn to move with our hips. Our hips can move a whole bunch with our spine staying still, and our shoulders can move a whole bunch. I'm going to teach you the difference between, this would be hip movement, and I can get from here to here without my lower back going anywhere. And versus spinal movement looks like this. So once again, that's spinal movement. That's what we want to get out of. And this is hip movement. Is that back should stay relatively, really as still as you can, moving about your hips versus moving about your spine, okay? Now, this is a new way of moving. This is a new way of thinking about movement. Dr. McGill calls them engrams. I'm not actually entirely sure the etiology of the word, or the meaning of the word, but ENGRAM is ingrained movement pattern, is how I remembered it. So your ingrained movement pattern, if there is something on the ground and you're not thinking about it, you have a movement pattern built in your head. I'm just going to pick up that pen like that. And if you don't think about it, then, and you don't learn a new pattern of movement, then that's where your recurring back pain is coming from. We need to rewrite that program. It's like a computer system. We need to override it with a new, better movement pattern of going like this or like that, and I'll teach you those in a bit, so that we don't move as much about the spine, allowing your back to heal, okay? So that's what I'll get into. So what are the new movement patterns, and what are some spine sparing, like how do you move better, basically? So I'm gonna always go back to find neutral. So go from here to here. You don't need to go all the way, don't cause your pain, but just think about that. Find neutral, core brace, and we're gonna do the shortstop squat first. So shortstop squat in baseball, hands on their thighs, let your hands slide down your thighs and grab your knees. I want your upper body weight transferring through your knees, okay? If not, then the movement just isn't the same. You end up bending your lower back a little bit. So from the side, hands are there, slide them down and grab your knees. What this ends up doing is it basically forces you to move about the hips. So we want to have that spine locked in, move about the hips, get to there, and then squeeze your butt, pull your hips through. Down to there, squeeze your butt, pull your hips through. This is teaching you how to move about the hips, okay? Next is the golfer's lift. So when a golfer is putting their tee into the ground, usually they have their golf club on one side, so I'll use this as my golf club, and this is about moving about the hips. And going down like that to get something from the ground versus going like this, you see the difference in my back. This is a lot of back rounding and spinal movement. If I stick that leg out behind me, there's a lot less spinal movement and spinal flexion that ends up happening, and my back is able to stay within about neutral. So if you can, use the golfer's lift to pick something up off the ground, always having with something beside you for stability. The third tool you can have is the lunge. So lunges sound kind of scary, but basically take a knee is the simple explanation. So still good to have something beside you for balance. I'm going to find neutral, lock it in, core brace, and now take a step backwards and take a knee. That is one of the best ways of getting down to the ground. And then your other foot can go down behind you, shortstop squat, basically keeping your spine neutral. And here I am, I can do whatever I need to down here. Now keep in mind, once we're here, we're not going to be moving around and doing all this stuff with our back. We're trying to keep our back locked in order to get back up. Walk your feet back to your knees, pull your hips through. For balance, one foot up, and stand up from there. So those are 3 different ways. Learning all of those, keep your spine still, and learn to move about your hips and not about your spine. Okay, so all of these 3 movements are ways of moving without having this move almost at all. The less movement, the better, allowing no more scabs to be ripped off. Finally, how do we apply this to our day? So what are some movements that you do during the day where you break this, this rule of a neutral spine? So let's say you're brushing your teeth in the morning or at night, and then you go to spit in the sink. So here's an engram, an ingrained movement pattern that you just won't think about. Brush your teeth, spit in the sink. What just happened? So that's one example. Getting ready, put your pants on, put your socks on in the morning, and when you go to put your socks on or your shoes on, what does the back look like there? So that's another example. Same for putting shoes on. So the corrective movement for both of those would be find your neutral, brushing your teeth, and bend forward about the hips, try to just think about there's a little inward curve in your lower back that I want to maintain. And if you can even put your hand on your back. Just see if you can move without this moving. Spit in the sink, pull your hips through, come back up. So thinking about keeping this lower back neutral when you're doing these movements, okay? Next one was putting on your socks or your shoes in the morning. The way that Dr. McGill recommends is find a bench a little bit higher, get your shoes, and then put them on the bench. And then from there, you need to be able to reach, but put your shoe on from there. And this is a much more neutral spine than it would be from me sitting on the bench and leaning over. Vacuuming is another really big one that I have for lots of people that have back pain from it. So how can we vacuum or sweep the floors or move in that way without hurting our back? So we're going to think about neutral spine. How do people often vacuum? They might go like this, and the amount of times that you're vacuuming with your feet planted and your back is doing the movement versus a new way of moving is you have your neutral vacuum cleaner, and I'm going to walk to do my vacuuming, and I can still do this, but this stays still. When I vacuum my house, I actually just walk back and forth in a big line, and I go back and forth just like this. I vacuum using my hips. My spine stays relatively still. If I need to get under something, then I'll go into a little bit of that hip movement, spine stays still, and I can go like this without this moving. So this is about rewriting these ingrained movement patterns to keep your lower back still for long enough to allow it to heal and to stop ripping off that scab. So if you can learn these new ways of moving, especially if you know what movements throughout the day cause your pain, you need to rewrite those movement patterns. You need to find a way to get into the car, to put your shoes on, to whatever, so that it stops hurting it or re-hurting it every day. If we can rewrite those patterns, stop ripping off the scab, it'll allow it to heal. And then we're gonna get into more pain-free movement, in which case we're gonna start to make the back strong. So that's gonna be part 3 of our video series. In recap, position of relief, so laying on your belly or reaching over top of your head or sitting, depending on what your problem is or where your injury is, what type of back pain you have. Different versions of those will provide you relief. Find one that works for you. Hip movement versus spine movement. So spine movement is here. Hip movement is about moving about your, basically take your hand, put it on your back, and you shouldn't feel those muscles move at all. Core bracing, if you can turn it on, we use a dial switch analogy, so squeeze the belly, and you can squeeze as hard as you can. Maybe dial that back to 50, 30%, just turn these muscles on. Spine sparing movements, the shortstop squat would be how to sit in a chair, if you can, or how to sit down in the toilet. Learn to move with your hips, not with your back. The golfer's lift, if you need to get something off the ground, find neutral. And then core brace, and then move about the hips with something beside you to hold on to. And then finally, the lunge, take a big step backwards, and that's how you get down to the ground. Finally, movements throughout the day, spitting into the sink. So think about all these movements throughout the day where you're breaking this rule, and we need to stop breaking that rule. We need to take a couple weeks and rewrite a new movement pattern so you learn how to move in a different way, okay? Feel free to watch this video several times and reach out to your exercise specialist if you have any questions about it. My name's Kevin, thanks for watching.